So, Dr. Anupriya, 20% of pregnancy result in a loss. So thank you very much for doing this together with us. A lot of women that I spoke to, they feel very shameful about this pregnancy loss. They feel that their body cannot provide. They feel the guilt, they have because something they do caused the loss. And sometimes there's no closure. Many carry this grief, shame, and guilt their entire life. Today, we would like to support women on how to move forward with the loss and grief, because sometimes we can take this intense emotion along with us, knowing that it's okay, and even better if we can transform this intensity and energy to something more purposeful. So today, the chat with Dr. Anupriya will have two parts. The first part is on grief, and the second part is on hope. Dr. Anupriya, my first question would be, what are the statistics on loss due to chromosome abnormalities?
So actually, 90% of all human losses are attributed to chromosomal abnormalities. It's a big number, and fortunately, as the human race has evolved, we have become so evolved that nothing but the best will do. So that is the first reason why human reproduction is so inefficient, which means unlike the lower mammals, the dog and cat, they will mate once and it will certainly, almost certainly result in an offspring. For us, it is the other way around. Only 10 to 15% of conception per cycle, per time when you have the opportunity. Even if you tick all the boxes, you have intercourse regularly, ovulation is happening, everything is okay. Even then, it's only 10 to 15% of success rate per cycle. And of course, if there are issues, then that percentage goes even lower. And then amongst those that do get pregnant, there is a significant number, about 15 to 20%, who will result in a miscarriage. And most of these miscarriages will happen in the early pregnancy, within the first 8 weeks of conception. And that is, most of those losses are because of chromosomal abnormalities. Losses that happen later on in pregnancy are less likely to be because of chromosomal issues. They are more likely to be because of certain other problems, with either the uterus or with the way the mother's body condition is. Certain medical problems will result in late losses. But early losses, most of them are because of chromosomal abnormalities.
Wow, 90%, that's really high.
Yeah.
Is there anything we can do about these chromosome abnormalities?
Yes and no. We can start trying earlier because we know that the percentage of human embryos that are abnormal will increase as we grow older. So the younger we are, there's a lesser chance of chromosomal abnormalities. For example, say at the age of 30, the risk of chromosomal abnormalities is about 1 in 700. Whereas by the time you are at, say, 40, the risk increases to 1 to 2%.
Okay. So age is one factor.
So age is an important factor. The other things are like taking adequate folic acid, because folic acid is a very important chemical which is needed for cell division. And it is usually in the cell division that things go wrong. When egg and sperm meet, one cell is formed, and then this one cell has to then divide and keep on dividing to be able to form the baby. And it needs the raw material to be able to do that. And if that raw material, the folic acid, the other vitamins, proper nutrients are not there, then there's a higher chance of things going wrong.
Okay, so I'm hearing age, I'm hearing nutrients, like folic acid and supplements. This chromosome abnormalities, you mentioned about age. Is it just the women's age or the man's age plays a part as well?
Well, mostly is the woman's age. Man's age has a much lower chance of affecting or influencing the risk of chromosomal abnormalities. Yeah.
And so what's a healthy age guideline?
The sooner you start, the better it is. Actually, human reproduction is at its peak in the early 20s. And
Wow.
after that, it's just a downward slope. Till about 35, the downward slope is gentle. It's a gentle downward slope. After 35, the slope becomes more steep. And after 40, it's pretty much like a free fall.
So is that why the reason people say, your biological clock starts ticking
Correct.
when you're in your 30s, and then 35, it seems like to be the guideline. If you're 32, you still like, it's okay. The minute you pass 35, okay, you might be high risk.
So that's not actually true. People seem to think that 35, there's some door that closes, and after that. So I see a lot of women at 34 and a half, because they think that 35 is some magic number, and beyond that, it's all going to be bleak. No, it's not like that. It's not like suddenly you're at 35, something goes wrong. But the fact is that it is a downward slope. And after 35, for most women, this slope will become much more steep.
I'm curious, what are statistics on loss due to our body, the women's body, not being able to provide a suitable environment for the embryo?
So some of us, we have this certain disorders which make our blood, in very simple terms, thicker or more clottable. So as the uterus grows with the baby inside, it needs a lot of blood to flow through. Now, normally the uterus is only about the size of a hen's egg. But of course, by the time the baby is big, it's a huge uterus, right? It's bigger than the baby. So because of this growth, the quantum of the growth required, there is an increased demand of nutrients to flow through. Now, the uterus is fed by two small arteries, which are maybe 2 millimeters in diameter in the non-pregnant uterus. But these become about 1 centimeter or more in diameter by the time the baby is delivered. And so the body adapts to provide more nutrients to the baby. And the mother's blood, for some of the mums, it is quite thick, and that blood doesn't flow through as easily as other mothers would. And that results in issues, because the baby doesn't get enough nutrition beyond a point in time, and then the baby dies. Other cases, the mother's increase in the diameter of the uterine arteries, or a relaxing of the uterine arteries, which should normally happen, doesn't happen. And when it doesn't happen, then it results in quite tight arteries through which blood cannot flow. And again, the baby doesn't get enough nutrients, and that will result in problems. In other women, there are certain autoimmune conditions like SLE, which can cross through the placenta. The antibodies can cross through the placenta and again result in fetal growth problems and not let the baby grow. So these are the common problems. Of course, this is not an exhaustive list, but these are the main groups whereby women will or may have problems.
And you say this main group where our body not able to provide a suitable environment, it's about only 5 to 7%.
Correct. Yeah, it's common.
It's the one that's the chromosome abnormalities. That's the common one.
Correct.
Okay.